Good afternoon, one and all. Myself, Sonali Atre, welcome you all in the International Breastfeeding Week celebration 2023. Every year, Bharati Vidyapeeth deemed to be University College of Nursing Pune celebrating International Breastfeeding Week from 1st August to 7th August. First of all, I would like to introduce our respected Principal Madam, Dr. Mrs. Bhagyashree Jogdeo. Madam has completed MSc and PhD in nursing. Madam is principal cum professor at Bharati Vidyapeeth deemed to be University College of Nursing, Pune. She is HOD of Child Health Nursing Department. She is total 13 years clinical experience and 17 years academic experience in the field of nursing profession. Madam has received Best Teacher Award from TNAI Pune City Branch in 2014. Madam has received Best Nurse Award from Rotary Club in 2000. She is recognized as an Inspector of Indian Nursing Council for Quality Control in Nursing Education. Madam is CAP Director for Nursing Program in Bharati Vidyapeeth deemed University since 2019. Madam is member of Research Advisory Committee at Bharati Vidyapeeth University. Madam is observer and speaker for CNE program Nursing Council Maharashtra. Madam has been invited as a resource person in 46 conferences and workshops. Madam has worked as an organizing committee in more than 26 conferences. Madam has attended as a delegate in 27 conferences and workshops. Madam is in process of writing the book in Child Health Nursing Department, CBS publisher, New Delhi. More than 36 publications in international and national journal. Madam is research guide for PhD, UG and PhD students since 2013. Four research activities in his process. Now I would like to request Dr. Mrs. Bhagyashree Jogdeo Madam to give keynote address. Over to you, ma'am.
Good afternoon, dear participants and eminent speakers. Today you all are here with on virtual platform to celebrate a breastfeeding week. As you all know, every year we are celebrating the breastfeeding week. It's a tradition of Bharati Vidyapeeth College of Nursing Pune that 7 days we have a different activities. So with that we have a one activity that is an international webinar for the participants or for the students, and this if you see the delegates are from the different backgrounds. Some are the policy makers, some are the working women. So the what I can say, it will become a concrete input for the delegates. So if you see the theme of the WABA for this year is enabling the breastfeeding, making a difference for the working parents. So this year they are focusing on the working parents, having the four themes in their mind, which includes the first is to inform the people about the working parents perspectives on breastfeeding and parenting, which is a core part. Then the next is anchor optimal paid leaves and workplace support as important tools to enable the breastfeeding. And third is engage with individual and organizations to enhance the collaboration and support for the breastfeeding at work. It is not only we are providing the infrastructure, not we, all are not only providing the infrastructure, but with that, what are the factors affecting the breastfeeding? They need to care of that aspects also. With that, the fourth objective is galvanize action on improving the working conditions and relevant support for the breastfeeding. Due to COVID, we all suffered, and if you see the percentage of the breastfeeding and the percentage of the breastfeeding for the working women, really the figures are very, we can say, alarming for us. So just to make the society aware about these all things, we have some eminent speakers for this international webinar. That the first speaker is Miss Raji Varghese from the Qatar. She will share her experiences. Her specialty is OB-GYN. Then Miss Pranalini Padeshi from the Cambridge University. They all speakers are having a huge experience in their field. With that, we have Vaibhavi Maske. She is a lawyer of Red Dot Foundation. She is working for the women empowerment for a different level, we can say. With that, we have our lactation consultant, Miss Rashmi Poduval. With that, we have Mrs. Vaishali Dhungde, matron of Bharati Hospital and Research Center. So it is not just I inform you, it is not only providing the infrastructure, but what are the factors are affecting the breastfeeding? We need to work on that for the working women. And if you see the working women, which is the important factor, the stress, because with the homemakers, they are having the additional responsibilities. It is not only they are working, they are taking the responsibility of their daily whatever the work is required to maintain the her family routine and these all things. So with that, they are more stressed than the person who is staying at home. So in this scenario, what options are available for them, how they can take the different we can say different methods to protect the breast milk for the longer hours in the room temperature in the fridge, so the baby can get an adequate amount of breast milk. Okay, so it is not only the 6 months exclusive feeding and these all things. With that, okay, government is providing a 6 months maternity leave. It's okay, it's very good session. Even the private organizations are also following the same rule. But after that also, we have a role as a human being, because it is not completely stopped, it's a complementary feeding. So for that also we need to help the lactating mothers. I hope this webinar will be helpful for you, and I hope you will enjoy this webinar. All the best.
For next session, I would like to introduce our next speaker, Rashmi Poduval ma'am. Madam has done her master in health sciences dietetics. Currently, madam is working as a lactation consultant at Devi Patil Medical College Hospital and Research Center, Pimpri, Pune since July 2022. She is in charge of Nectar Human Milk Bank, KEMH Pune. She is International Board Certified Lactation Consultant. She is LER Certified Breastfeeding Specialist, and Madam has total 15 years of experience. Her area of expertise: lactation management in NICU, human milk banking, complementary feeding, and induced lactation and relactation. I request Rashmi Poduval madam to proceed with the session. Over to you, ma'am.
Hello everyone, this is Rashmi Poduval. I'm a lactation consultant. I would like to thank Bharati Vidyapeeth College of Nursing for giving me this opportunity. Today I'll be talking about Mother's Delight Human Milk Bank. Let me share my screen. I'll begin with a disclaimer. I have no conflict of interest. I have nothing to disclose. Pictures that I have used in this presentation are taken with prior consent, and I would request everyone to not take any screenshots or photos. They are copyright protected. A little bit about me. I'm a lactation consultant from Pune in India. I have a work experience of 15 years. Currently, I'm working at Dr. Devi Patil Medical College Hospital and Research Center in Pimpri, Pune in India. Earlier, I have worked with KM Hospital and Sahyadri Hospital, Shastri Nagar in Pune. In this last 15 years of my experience, I've been fortunate to be associated with 2 human milk bank. I was in charge at KM Hospital Milk Bank, which is Nectar Human Milk Bank. And currently, since last 1 year, I have been associated with and supervising working of Yashoda Advanced Human Milk Bank at Devi Patil Hospital. I also have my own initiative, Lactation Support for You, where I provide virtual consults. So what are the learning objectives for today? We'll know about what is role of human milk banking in neonatal care, what actually is a human milk bank, what is the infrastructure that is required, what is the flow of work and various processes that are carried on in an HMB, and how to maximize the milk donations so that maximum mothers and babies can benefit. So what is the need for HMB? The NFHS 5 data, that is National Family Health Survey, which was done in 2019 to 2021, it was seen that exclusive breastfeeding up till 6 months was around 64%, and early initiation of breastfeeding was near 42%. So the data shows that we are progressing gradually, but we still have a long way to go. Every year, around 27 million babies are born in India, out of which 7.5 million are low birth weight, 3.5 million are preterm. Out of this, 0.76 million infants who die in the neonatal period, around 35% prematurity is the major cause. It is a well-known fact, this data was published in the Lancet, that under 5 deaths can be prevented by many interventions, out of which breastfeeding is considered as one of the single most powerful intervention, which has the capacity of preventing almost around 16% under 5 deaths. In India, this data was published recently. What is the cost of not breastfeeding? If a mom is not able to adequately breastfeed her baby, what does it cost the country? So only by that, around 1 lakh child deaths can be prevented. A lot of babies who die with diarrhea and pneumonia can be prevented. Mothers who are getting impacted by breast cancer, ovarian cancer, and type 2 diabetes can also be prevented. And just with that, the country is spending around 8.75 billion, that is 875 crores in the healthcare costs. So huge impact. We know that mother's milk is liquid gold. Why? Because it provides optimal nutrition and it also helps to prevent illnesses in the babies. It is superior to any formula and any other animal milk. Studies have demonstrated that there are many benefits for the vulnerable infants who are admitted in the NICU for different reasons, preterm, low birth weight, sick babies, because it helps to reduce risk of sepsis and NEC, that is necrotizing enterocolitis. They show better feeding tolerance. There's decreased length of stay in the NICU, and there's substantial cost savings, as we've already seen. So what are the recommendations? So both World Health Organization and UNICEF recommend that mother's own milk is the best for her baby, and even more so if the baby is preterm, sick, or low birth weight. Mother's milk should be the first priority. When the baby is unable to receive the biological mother's own milk, which is called as MOM, M-O-M, the next best alternative is donor human milk. In order to ensure that a safe supply of breast milk is given to all infants, human milk banking is the safest mode of doing this. So what is a human milk bank? It is an elaborate setup established for the purpose of collecting, screening, processing, storing, and distributing donor human milk. We are aware that the first human milk bank was opened in Vienna in Austria in 1909. But the first human milk bank in India was established quite later, in 1989, by Dr. Amida Fernandez in Lokmanya Tilak Municipal Medical College and General Hospital, which is in Mumbai in India. This is a picture from that milk bank. So things have definitely progressed. I see a lot of milk banks, new milk banks coming up even in India. So currently, what is the status? Currently, there are more than 750 milk banks in around 66 countries. In India itself, there are approximately 115 human milk banks, out of which in Pune, where I stay, there are around 7 human milk banks. We know that Brazil has the most comprehensive network of human milk bank and lot to learn from them. More than 8 lakh infants receive donor human milk every day, and over 1 million liters of milk is being donated annually. What does human milk banking aim at? It aims at improving breastfeeding practices. We know that where mothers are donating a lot of milk, automatically the milk supply increases and their babies also receive more than adequate breastfeeding. We are working, it also aims at reducing neonatal and infant mortality and morbidity and improving maternal health. We also aim at providing safe human breast milk to babies where mothers are unable to breastfeed. What are the indications for pasteurized donor human milk? So mainly babies who are preterm babies, low birth weights, sick babies, babies who are admitted for GI surgeries, babies who have allergies, who have intolerance to formula, mothers with postpartum illnesses who are unable to express milk or unable to be with the baby, or mothers in which breastfeeding is contraindicated, babies whose mothers are going through lactation failure or lactation insufficiency. So up till the milk supply improves, donor milk can be given, and a baby whose mother is diseased and not there. So what are the different areas and sections in an HMB? These pictures are taken from the milk banks that I've worked in. We have one reception area where the donor moms and the recipient families can be welcomed and screened. Then there has to be a nice, cozy, comfortable milk expression room with all the provisions for expressing milk like breast pumps. Then there will be a working area where all the processes and procedures are carried out, which we'll be learning later. Then there can be a separate storage area where refrigerators and freezers, deep freezers are kept. We can also have a counseling area and a educational or training room where the staff and mothers can be trained. So what are the different equipments that are required? A milk bank should have air conditioning, pasteurizer, which is the main equipment. Then deep freezers, preferably 2 deep freezers are required, which are at -20 degrees, because in one we can store the raw milk and in another we can store the pasteurized milk. A normal refrigerator, which can be used for storing fresh milk or thawing of that milk. Laminar airflow or a room sterilizer to keep the environment hygienic and sterilized. Hot air oven, autoclave or induction, again for sterilizing equipments. Breast pumps, mostly hospital grade breast pumps if possible, and also manual pumps, and a generator or an uninterrupted power supply. So these are the equipments. So this is this dairy-fed pasteurizer, which is used in many banks, human milk banks in India. This is an indigenous pasteurizer from India. This is a laminar airflow. Here we can see that induction is being used to sterilize equipments and containers. A normal refrigerator, a vertical deep freezer, which has -20 degrees Celsius, and a horizontal deep freezer. Then hospital grade electric pumps can be very beneficial. So there are variety of hospital grade breast pumps wherein mothers can comfortably express milk. They are quite efficient. They give a very good hormonal stimulation. Mothers can express in a shorter duration, and it also is pain-free or painless. Different equipments that are optional. So they are value additions to a human milk bank. So we do have a milk analyzer, which is used to measure the macronutrient content of mother's milk. So carbohydrates, proteins, and energy can be calculated, fats can be seen. Sonicator or homogenizer, which is usually used to homogenize the milk before we can analyze it. A steam sterilizer to sterilize the containers, bottles, breast pump parts. Air purifier can be there. Then a cap sealer to just seal the containers and caps of the bottle so that the milk does not spill out or get contaminated. And we can also have a barcode scanner and printer. So what happens in the milk bank? This is the procedure that is followed. So when a mother comes to you, first she is screened for all her health histories taken, ensuring that the mother is healthy and she is eligible for milk donation. Once that is known, then we take a donor informed consent from the mother, which says that okay, she's willingly donate and yes, she has that excess milk to donate. Then our staff will teach the mother the correct technique of milk expression, where the milk can be safely expressed, and then this milk is stored safely in the refrigerator or the deep freezer. If it is stored in the deep freezer, then the milk will be thawed first Many milk banks would pool the milk first and then pasteurize. Post-pasteurization, a small sample will be sent to the microbiological lab for checking and testing. Once we get that the reports have come sterile, we keep this in the deep freezer. We continue keeping that in the deep freezer, and only when the reports are sterile, this will be given to the needy babies, but on doctor's prescription. So who are the potential donors? So any mother who is willing to donate and has surplus milk, we can aim at encouraging mothers who themselves have their babies admitted in the NICU, because anyways they're expressing milk for their babies. So whatever excess is there, that they can donate to the milk bank. Mothers in the postnatal wards who have oversupply, usually by 3rd to 5th day, if a mother is having engorgement and her breasts are too heavy, then anyway she'll be expressing, so that excess milk she can donate. Mothers who are visiting the hospitals in the follow-up clinic, vaccination, OPD, they can be encouraged. And we can also go into the community and encourage the mothers there who have a surplus milk supply. So what all is included in screening? Physical examination of the breast is done just to see that mother does not have any infection or mastitis. Her clinical history and records are checked to ensure that she is healthy and not suffering from any acute or chronic illness. She should not be taking too many medication, herbs, mega doses of vitamins. She should not be abusing drug, alcohol, or tobacco products. And she should not have had any blood transfusion or organ transplant in the last 6 to 12 months. We also require to check her recent reports around 3 to 6 months max. The serological screening needs to be done for HIV 1 and 2, hepatitis B and C, and for syphilis and VTRL. So only when we ensure that she is negative for all these, she is then eligible for donating. Milk donation is completely an informed choice. Written consent of the donor and the recipient also is must. Donors can be encouraged, but they cannot be forced to donate milk. We cannot give any compensation or anything to the mothers who are donating. It is completely willingly they have to donate. We have to ensure that the mothers, the donor mothers and the infant of the donor mother will not suffer in any way if she is donating her milk, and all her queries and concerns need to be addressed. What are the milk collection precautions? We have to ensure that mother follows all the hygiene protocols, hand hygiene, breast hygiene. Then she needs to be taught correct and safe method of milk expression, even how to use the pump, how to ensure that the pump is hygienic and sterilized, what is the correct method, what pressure and what suction to use for a pump so that she does not injure herself while pumping. Cleaning and sterilization of the storage containers, and then labeling these containers and safe storage of the milk in the deep freezer. Breast assessment would include all these things. So we'll have to check whether the mother has any nipple injury, any signs of infection, any engorgement, mastitis, abscess, because in that case, we'll have to tell her if she's engorged, then how to express correct massage technique. If there's mastitis and abscess, then she'll not be able to donate. And if there is any discoloration of milk or any rash or eruptions, so that will need to be checked. What are the guidelines for the staff? So staff need to strictly follow all the standard operating procedures, SOPs. They have to follow all the hygiene practices like hand washing, donning of gowns, wearing masks, gloves, trimming of nails, locking of long hairs. Everything needs to be maintained. Even the gloves need to be changed in between handling of the raw milk and the pasteurized milk. This collected milk needs to be properly labeled. So the storage container should have registration number of the donor, the date and time of donation, so that we know till when it can be used. What is the volume collected in the container? And if possible, also mention the age of donor mother's baby, because that will help to separate the term and preterm milk, which is different, which has different milk composition, and at most of the human milk bank, we aim at providing preterm milk to preterm babies. So we try to match the age of donor mother's baby with the recipient baby. Then this milk is stored, and we need to follow the protocols for safe storage. So milk can be stored out in the room temperature for around 3 to 4 hours, 24 hours in a refrigerator, and in the deep freezer, that is minus 20 degrees Celsius, it can be stored for 3 to 6 months. For storage, food grade plastic bottles can be used, which are BPA free. Normally, polythene bags are to be avoided. They are fragile and associated with decrease in IgA. There can be loss of vitamin and lipids, and there's risk of contamination. So the bags might get punctured and might get contaminated. In Indian setup, many a times, even stainless steel containers with tight fitting screwed caps can be used. They are easily available, durable, easy to clean and autoclave. So that works well for our setup. So what is pooling? Pooling is when the milk of 4 to 6 donor mothers is mixed together. The numbers are usually kept low so that we can trace back it to the source. So if there is any issue, any contamination that has happened, or any culture has come positive, so we should be able to trace back to the donor. So that is why the numbers are kept low. But what is the benefit of pooling? It averages the immunological and nutrient content of the milk. So it actually might improve the overall content of the pooled milk. And it is preferably done under aseptic conditions in a laminar airflow. It should be avoided. We should avoid shaking of that milk. So to make the milk homogenize that milk, we can slightly swirl that milk. Few milk banks do conduct pre-pasteurization testing of this milk. So before pasteurization, a small milk sample will be sent to the microbiological lab to see for microbial contamination, and the sample needs to be discarded, or the milk needs to be discarded if in case it is found that the milk contains more than 10⁵ colony forming units CFU per ml for viable microorganisms, and 10⁴ CFU per ml for Enterobacteriaceae and Staphylococcus aureus. Pasteurization. Normally, what we follow is the Holder pasteurization method. So what is pasteurization? In which the milk is heated to about 62.5 degrees Celsius. That temperature is maintained for about 30 minutes, and then rapid cooling of that milk is done till about 4 degrees Celsius. So at 56 degrees, it has been seen that most bacteria and viruses are deactivated, while it also helps in retaining maximum immunological and nutritional properties of the breast milk. Around 1 to 2 ml sample of this pasteurized milk is sent for post-pasteurization bacteriological screening, and any positive culture that comes after pasteurization, that milk needs to be discarded. So post-pasteurization, there should be no growth in that milk. How do we store and label? So this pasteurization batch that is made, so it is labeled with the batch ID and the expiry date. So taking into consideration that it can be stored in the deep freezer for around maximum 6 months. Accordingly, the expiry date needs to be mentioned. Post-pasteurization, once the sample is sent, this needs to be kept in a section in the deep freezer where we write as report is awaited. The report would take anywhere between 2 to 3 days. And only when this report comes as negative, then this will be kept in the dispensing section where the milk can be, PDHM can be dispensed to the needy babies. So how do we dispense this pasteurized donor human milk? On a first in, first out basis. So whichever milk donation has happened early, or whichever batch is prepared early, needs to be dispensed first. Only on doctor's prescription, according to prioritization. So preterm babies and low birth weight babies would get the first priority, depending upon the stock that is available in the milk bank. then this milk is thawed by keeping it in the refrigerator. So slow thawing is done, and then it is dispensed on obtaining informed consent from the recipient family or the legal guardian. So before administering even 1 drop of pasteurized donor human milk to any baby, we need to have proper informed consent where recipients are told about everything, what all is done, all the processes, and all the pros and cons. A well-equipped milk van, a van which has breast pumps, all the documents, and which can go from places to places in the community, go to donor mother's house and collect milk, and even take recipient milk to different places. It can be a boon for milk banks. So a good, well-equipped milk van is quite an essential thing. How do we ensure that maximum mothers and babies benefit? Strive for human milk for all babies. So we should strive for that all babies, not just preterm, but well babies, should get mother's own milk. And if in case that is not available, then we should make provision for donor mother's milk, that is pasteurized milk. This can happen only and only when we support all mothers in their breastfeeding journeys, because only when they do well in their breastfeeding, they have a good supply, is when they'll be able to donate for needy babies. This starts with antenatal period, antenatal breastfeeding counseling, and sensitizing mothers about the importance of breast milk, resolving the myths and misconceptions that are prevalent. Community awareness and education is very important. In today's time and era, we need to utilize the power of social media to spread this message across and encourage more and more mothers to come forward and donate their milk to milk banks. Family and peer support needs to be encouraged, and they need to get education so that mother receives a lot of support from everywhere. And we need to provide recognition to the donor mothers. So obviously, we cannot financially compensate donor mothers, but what we usually do here is we give them with the certificate, and we do call them for our programs. We do felicitate them, and we make them feel important, and we ask them to talk to new mothers who are perhaps skeptical about milk donation. So when they hear from these mothers that how milk donation helped not just the babies whom they were providing with, but in her own journey as well, more and more mothers would be encouraged. I come to the end of this presentation. My contact details are given here. If anybody has any queries regarding milk banking or anything about lactation, please feel free to contact me. Thank you so much once again.
Thank you, ma'am, for sharing your valuable information on Mother's Delight Human Milk Bank. For next session, I would like to introduce our next speaker, Dr. Sujita Devi ma'am. Madam has done her PhD in nursing, currently working as an assistant professor at Bharati Vidyapeeth College of Nursing, Pune. Madam has 19 years academic experience in the field of nursing profession and 1 year clinical experience. Madam has elected as TNI Pune branch secretary. She has elected as alumni treasurer for the period of 5 years. She has appointed as CAP director for Bharati Vidyapeeth University examination in nursing. Madam has appointed as a research cell committee member from Department of OBG at college level. She has guided undergraduate research project and master dissertation. Madam has recognized PhD research guide in the Bharati Vidyapeeth University. She has panel of research advisory committee approved at PhD faculty of nursing. Madam has a resource person for conference and workshop. She has organizing committee members. She has attended 25 conference and workshop. Madam have lifetime members of TNI, IANN, NRSI, SOMI, Innovational Research. Madam has in a process of writing comprehensive nursing MCQ for nursing competitive exam and obstetrical and gynecology procedure manual book, CBS publisher. Madam has published various research in national and international journal. I request Dr. Sujita Devi ma'am to proceed with the session. Over to you, ma'am.
Good afternoon to everyone. Thank you, Sneha. Now I am starting the topic. Today we are going to see about the handling and storage of human milk at home. How as the working women who are working in the hospital or in the any service, they have to join back the duty again after 6 months. So that time they need to be do it, how to store it at home. So, handling and storage for working mothers, one factor which often discourages them from breastfeeding or giving up once they return to work is how to balance breastfeeding with their tight working schedules. The good news is that with adequate preparation and adjustment, you can still continue with breastfeeding. So, preparation should start soon after your delivery. It involves building a good milk supply, expressing and storing best milk. So I have already said how to store the milk at home. That is very important. Expression of breast milk. It is a simple way of taking breast milk from breast without baby needing to suck. In this condition, with the different methods that with expression of the breast milk, the woman can keep the milk at home. Why to express? In some situation, we have seen in the hospital also, some women has problem with the breast engorgement or any problem in the breast. So they feel the discomfort. So that time also we need to express the breast milk. And if the baby is having weak suckling, if the baby is not able to suck properly, that time also we need to express the milk and we need to be give by water spoon or that we can follow it. Next, for working women, already I have said that the women who are working any service or who are doing the job, they need to be remove the milk and they need to be keep so working women and to increase the supply. Or sometimes some women has more production of the milk, so in that case also we we remove the milk, we express the milk, and that milk can be donated in the human milk bank. How to express? So it is very important procedure ki how to express the milk. So before expression, the most important is we need to be have a place a picture of your baby blanket and clothing that has his or her scent on it. Think of rest setting. Ensure a clean environment. Apply the warm massage to the breast. Remove the milk during the times your baby would normally breastfeed. Hand expression. Gently massage the breast. Second, like that in the picture diagram, we have to be massage the breast. Second is hold the breast in the C shape. That we need to hold the breast in the C shape manner. Push backward towards your chest. Like this, we have to be push backward that the breast towards the chest. Express the milk with the help of thumb and fingers and slightly press forward. So in this way, the hand expression of the milk can be done in first we have to massage it. Second, we have to be hold the breast in the C shape manner. Push, we have to do the pushing the backward towards your chest and express the milk. Pumping, there are different pumping available in the market. Manual breast pump is also available, and we can see the battery operated breast pump that mainly we see in the mill bank electric breast pump also. So these are the different breast pump is available. So this can be used for removing the milk. Way to express milk in their types. Hand expression, you in that how it works, you use your hands to massage and compress your breast to remove milk. What is simple in that we need to have the practice, we need to have the coordination, and we need to have the skill to do it. Manual pump, in here you need your hand and rigs to operate a handheld device to pump the milk. What is involved in that is we need to have the skill, practice, and coordination. Automatic electric breast pump that is run on the battery, and it has to be plugged into on the electrical outlet, and we can pump one breast at a time, or sometimes we can use both the breasts also at the same time. Pumping can be done it. Double pumping may collect more milk in less time, and in that we need the press of the equipments to be collected. Storage of the human milk at home is very important. After pumping or after removing, what need to be done is, here we have to label the depth of the storage container, gently swirl the container to mix the milk, and no shaking of the breast milk. Then we can use the plastic bottles, or we can use the glass bottles to store it. We need green glass or plastic bottle to store the milk. Bottle with tight lid is also important here. And milk storage bags are also available here. That okay, so before using we have to cut it. So these are also available, that the milk storage bag. Tips for refreezing or freezing. Leave an inch from the milk to the top of the container. Second is refrigerate or seal the milk right after it is expressed. Store the milk in the back of the freezer, not in the freezer door. Place it in a cooler or insulated cooler pack. Use the oldest store milk fast. Breast milk does not necessarily need to be what. So here what we have to do is, whenever we are keeping for freezing, in that the most important is we need to be keep the dates, and then after that we have to be store in the freezer. We not in the freezer door. And what first collection should be used first. Place in the fridge or defrost slowly. Place the container in a bowl of warm water before using, holding the container of the milk under cold running water. No microwave has to be done, and swirl the milk and test the temperature. And do not refreeze tips for thawing and warming milk. Thawing of the human milk. It should be labeled with the date and the milk was expressed and the child name. Always throw the oldest milk first. Thaw milk in the refrigerator or in a container of warm water. Do not microwave. Store the thaw milk in the refrigerator until ready to use. Use thaw milk within 22 hours of bringing to room temperature. Thaw milk should be fed to the child on that day. Never refrigerate the thaw milk. Store the frozen milk in the freezer. Keep an appliance thermometer in the freezer and check it regularly. The temperature should be 0 degree Fahrenheit or below it should be. So this is storage location and temperature guidelines. So here we will be able to see it according to the milk type of the breast milk. It is freshly expressed or pump milk that can be kept at room temperature up to 4 hours. If it is in the refrigerator, up to 4 days. In the freezer within 6 months is best. Thaw or previously frozen 1 to 2 hours, and we can use refrigerator up to 1 day. Never refrigerate after thawing. Leftover from feeding that can be used within 2 hours. Used within 2 hours, and you means that can be used within 2 hours only. So if the milk is left over, so this is the guidelines given by the CDC and USDA for a healthy full-term babies and premature or sick babies. So this temperature or this we have to be give the health education part to the mother when walking mother mainly, or when the woman is. So these are the topic. So if any questions about the storage, how to handle, how to keep, how to store a temperature, you can raise the question in the chat box. Thank you.